everyone, so I'm back again this week with another video for you all. For today's video, I'm going to try to talk to you guys about the brachial plexus. You should already be quite familiar with this concept, however, I will give you a brief overview of the different parts of the brachial plexus, maybe a couple of mnemonic devices that you can use to distinguish between those parts, and then finish up with a few clinical scenarios that you can use to practice associating the nerve branches with the muscles that they innervate. So let's jump right into our brief overview of the brachial plexus. Okay, so this is an even more simplistic representation of the brachial plexus than the first image that I showed you all at the beginning. This image is obviously not drawn to scale, however, it does show us the different parts of the brachial plexus in an easier to read manner. As you can see, these are the nerve roots that are coming out of our last four cervical and first thoracic vertebrae. After that, we have the trunks, divisions, cords, and terminal nerve branches that continue to branch further down to innervate different muscles and muscle groups in our upper limb. So how can we go about recalling their order of branching? By using this simple mnemonic device. Risk takers don't cautiously behave. So risk stands for our roots, takers represents our trunks, don't represents the divisions, cautiously is for our cords, and finally, behave represents our terminal nerve branches for the B in branches. Okay, so now I just want to give you guys a couple more tricks to help you distinguish between the nerve branches. As you can see here, there is a letter M being formed by the cords coming together to branch into our musculocutaneous, median, and ulnar nerves. To help me remember them, I called this area Mickey Mouse University. So Mickey represents our musculocutaneous nerve, mouse is our median nerve, and the ulnar nerve is our university. Now to help me distinguish between the locations of my radial and axillary nerves, I want to use a different image, so let's go. Okay, so to distinguish between these two, the radial and axillary nerve, I believe it's important to be able to help visualize where we're at. So what I did to help remember the axillary nerve is associate it with my armpit. This is because, as you can see in this image, the axillary nerve branches deeper into the area of our armpit than the radial nerve, and then back around to innervate our teres minor and our deltoid. And once you know that, you can see that our radial nerve riding down further than our axillary nerve in order to innervate the muscles of the posterior aspect of our forearm. Okay, now that we've taken some time to understand some tricks I used for the brachial plexus, I want to show you a couple different scenarios and ask questions for you guys to get some practice. For this part of the video, you can watch the scenario I described, then you can pause the video after I ask the question to work through it on your own, if you would like, before I give the answer. Alright, let's go. So this is my roommate. She is currently cooking some chicken fried rice, which tasted so good, by the way. For this part, I want you to pay attention to the actions that are occurring at her wrist and forearms in this video. Her forearm is flexed right now, for the most part, with a little bit of pronation and supination occurring as she is mixing the rice together. In order to perform this action, she definitely needs help from both her flexor and extensor compartments of her arm. Now let's focus on the pronating aspect. If she were to suffer damage to her medial and lateral cords, which nerve branch would be impacted that is allowing her muscle to pronate? That's right. Our pronator teres and pronator quadratus muscles allow for this muscle action, and they are both innervated by the median nerve, which is formed by the combination of the branches from the medial and lateral cord of her brachial plexus. Does that make sense? Alrighty, let's go into our next scenario. Okay, so this is my other roommate, and in this little clip, she's putting her hair in a ponytail. You see her upper arms are in an abducted position while her forearms are flexed in order to get her hands in the position necessary to do this. Now, I want you to focus on the action occurring at her shoulder joint, the abduction of her arm, and we'll see it again in slow motion. So, if she were to have damage occur at the level of the posterior cord of her brachial plexus, which terminal nerve branch would be impacted that is allowing her to abduct her shoulder? That's right, it would be her axillary nerve. Because we know that she is abducting, and we know that action is primarily performed with the help of her deltoid muscle, that muscle is innervated by her axillary nerve, which branches off the posterior cord of her brachial plexus. Does that make sense? I hope so. Alright, and that's it for this week's video. I hope I was able to break it down in a simpler manner, as well as give you guys another way to be able to study the brachial plexus, just in relation to the muscles that are innervated by its terminal nerve branches. Alrighty, I'll see you next time. Bye!